No secret that every year hundreds of thousands of men in this country are diagnosed with prostate cancer. Many of them undergo harsh and invasive treatments that they really don't need. Now, new tests are showing promise in reducing the number of these false alarms. Let's talk about it with Dr. David Samadi, chief of the robotics division at Mount Sinai School of Medicine, a Fox News medical A-teamer, and something of an expert in the treatment of prostate cancer. The PSA test has always been the standard. The problem is it gives a lot of false positives, right?
Yes, that's true. And PSA actually, John, stands for prostate-specific antigen. So not just prostate cancer specific. So many things such as enlarged prostate, inflammation of the prostate, and prostate cancer can really bump up that PSA. And that's part of the problem that we're having, that there are a lot of false alarms. Almost 4 out of 5 people that have this elevated test, they may or may not have cancer. And that's why they go through all these biopsies and they're unnecessary biopsies.
Yeah, so up to now, if your if your PSA number is elevated, you may have to submit for some of these biopsies and some of these very unpleasant and unnecessary medical tests.
That's true, but also in the hands of a lot of experts who deal with prostate cancer. Look, the PSA has gotten a lot of negative publicity over the past few years, and there has been a whole jihad against PSA. But the truth is, it's actually a good test. You just have to know how to interpret this. And a lot of people who deal with prostate cancer know that you have to look at the history of it, you look at the jump in the PSA, you have to examine the patient properly, and it's a detective work. But it's well said, a lot of these new tests that we're coming up, the genetic tests, are going to help us to distinguish who is really at risk and who is not.
So the tests that are coming on the market now use other markers to help really focus in on prostate cancer.
Absolutely, and we've been waiting for this for the last decade or so. A lot of companies are coming up with genetic tests that have different tumor markers and multiple panels. Instead of one test, one protein now, for example, OncoHealth has 4 different types. So that's really going to narrow, if 2 patients come into my office, both with elevated PSA, who is really at risk and who is not, and that's how we're going to cut down on number of biopsies. John, let me just say also that even after you've done the biopsy, or even if you've had the surgeries, there are genetic tests that are coming up to tell us who is going to fail the surgery, who's going to need radiation after that or not. So this is a very exciting time in the field of prostate cancer and genetic testing.
But isn't it also the case that some prostate cancers are so slow growing that treatment is actually worse than the illness?
So it's true. About 60% of the patients have this slow-growing indolent cancer. And also, but we want to be careful still, that still 28,000 people die. I just had a patient this week that actually his cancer is spread to the bone, and it's unfortunate because we could have saved him. So you really have to understand this disease and know who has that slow-growing, who is not. We are having some difficulty right now, but I'm hoping that with these genetic tests, that would really help us tremendously.
Good news for men so that they can avoid some of these questions.
Just talk to multiple doctors before you make a decision. That's a big thing.
Dr. David Samadi.
Thank you very much.
Thank you for coming on.